Hi, it's Dr. Mike, and the title of today's video is Fibromyalgia Wiki. So in this video, I'm going to give you a little breakdown or a short run through of fibromyalgia, the disease. We'll look at basically the classification, some of the risk factors, some of the symptoms, as well as some of the management. And then at the end, we'll also talk a little bit about prognosis, meaning what you can expect if you are diagnosed with this. So yeah, let's get to it. So before we begin, yeah, please note this is just intended to provide education about fibromyalgia. It's not intended to provide individual patient advice. If you think you have a condition like this, you should please talk to your doctor and get a proper diagnosis and treatment plan. So 2 to 8% of the general population is estimated to have fibromyalgia, and the estimates range between 5 and 26 million sufferers in the United States, of which 75% are women. It affects women and children of all ethnic backgrounds. It was first defined in 1990, and the cause is unknown. But it is believed to involve a combination of genetic and environmental factors. So, the classification of fibromyalgia is a disorder of pain processing, and this alters the way the neurological system processes pain, causing painful feelings to be amplified. Some of the signs and symptoms of fibromyalgia: chronic pain that impacts the entire body is the most typical symptom and widespread symptom. It's characterized by widespread musculoskeletal pain, so pain in your muscles and your joints and your body, fatigue, sleep problems, and cognitive problems. So there we're talking about memory and mood issues, fibrophagy, sometimes the name they call it, where you have trouble concentrating, trouble remembering things, and just feeling generally foggy. And then sensitivity is commonly reported as well. And those form the four main symptoms of some of the newer diagnostic criteria: pain, fatigue, waking unrefreshed, and cognitive symptoms. So what are some of the risk factors for fibromyalgia? So there are some genetic factors that have been identified, and particularly ones that relate to how your neurotransmitters are made and how they function. Neurotransmitters are little chemicals that basically that work in your brain and in your spine, in your nervous system or your nerves. Stress is also a huge factor, and there tends to be some kind of a triggering stress event in most sufferers. Sleep disturbances, so generally poor sleep, and waking unrefreshed. Lifestyle factors play a massive role. So people that smoke or overweight or have some unhealthy lifestyle habits, that does tend to be a risk factor for it. There has been some talk of food sensitivities, but it's not well defined in research and in studies. Things like gluten sensitivities and certain kinds of allergies to specific kinds of foods. And then obviously, gender. If you're a woman, it's a risk factor. And previous infections tend to play a role as well as a kind of triggering event. When we talk about the pathophysiology of fibromyalgia, then there are a few theories. The most encompassing one that's come through of late is nervous system dysfunction, and basically meaning that the way that your brain and your spinal cord work is kind of just, it's not working the way it should. And it leads to a state called central sensitization, which means that you suddenly become very sensitive to things that shouldn't cause pain all of a sudden do cause pain. And there seems to be some kind of neurotransmitter imbalance that seems to be coming through in some of the newer research. They also are finding abnormal stress responses, meaning that fibromyalgia sufferers, when they have stress, the way that their body produces stress chemicals and the way that their brain and nervous system handles those stressful situations doesn't seem to be quite a normal response. It seems to be an underactive kind of response, or an imbalanced response. And then they're also picking up signs of immune system dysfunction, meaning that the way that your immune system communicates and works to manage inflammation and immune reactions is a little bit out of balance. We see more inflammation, and especially in certain parts of the body. And then digestive system dysfunction is also one of the theories that plays a role. And there seems to be a lot of new evidence and research or theories coming through about how the gut, the microbiome affects your nervous system. There's a lot of communication between the enteric nervous system, which is basically all the little nerves and located in your gut, and this interplay or interaction between all the little bacteria in your gut, the balance of bacteria, and the way these cells produce neurotransmitters. Sometimes, you can actually be producing a lot of neurotransmitters in your gut. So there seems to be a clear link there, and that they call the gut-brain axis. So the diagnosis of fibromyalgia, at the moment, there is not a generally recognized feature or test to detect the disease. So meaning there's not going to be an X-ray or a scan or a laboratory test that's well established in the literature or research that proves that you have it. So that's one of the difficulties of the diagnosis. So at the moment, they base the diagnosis on this group of symptoms. It used to be just on the number of tender points you had through your body, but now it's a combination of things. And then in getting to the point where you get diagnosed, a lot of times there are a lot of tests and things that are done to rule out other conditions or other health problems. So when we look at fibromyalgia management, there is no cure currently at the moment, but treatments can reduce symptoms in some patients. And, a lot of the treatments do focus on management. Exercise comes through in the research. And that can be a wide variety of exercises. So it's not only, weight training, it's not only aerobic. It could be related to, lighter kinds of exercises, swimming or aqua type exercises, mindful kinds of movements like Tai Chi or yoga, or those sort of things. It varies, but a lot of sufferers tend to find that in the right dosage, meaning small amounts, that exercise can be very helpful. Then meditation and mindfulness seems to also be playing quite a big role in decreasing symptoms, and both of these have been shown to affect how your neurotransmitters work. So, and then medication. So there are a few drugs that have been approved by the FDA for treating fibromyalgia. And sometimes these can decrease some of the symptoms, but they won't cure it. A couple of nutritional supplements have come through in the research that have shown to actually decrease symptoms. So one of them is coenzyme Q10. The other is vitamin D. So a lot of times if you have low vitamin D and you supplement with it, it can decrease your symptoms. And then melatonin is a specific hormone that your body produces, especially at night. and that helps you sleep, and it's quite a good antioxidant. So those 3 supplements have come through in the research as having some beneficial effects. There are a lot of others, but for now, those are the ones that come through most commonly. Then psychotherapy, there is a big emotional component to this, and sometimes when people are having a lot of trauma and previous things that are affecting their state of mind, psychotherapy can help mitigate and decrease some of those symptoms, and ultimately that has been shown to help manage the condition. And then manual therapy, massage therapy, chiropractic, physical therapy, osteopathy, other kinds of manual therapies have been shown to have some benefit. So when we look at prognosis, meaning, what if you have been diagnosed with fibromyalgia, what are the outcomes? What can you expect? The research shows that the symptoms are chronic and do persist, meaning that, and that's why they say there's no cure, because basically once you've been diagnosed with it, it's always something that is an issue. Total of the relief of the symptoms is seldom achieved, but there are a certain percentage of patients that do get almost total relief, and the research is still ongoing into figuring out how to improve that. And then these symptoms don't lead to disablement and don't shorten life expectancy. So there is a lot of fatigue. It does affect your quality of life. And sometimes the symptoms can be really, when you have a flare-up or something like that, it can be really disabling. But they can be cyclical, or they can vary. But generally speaking, it's not going to cause tissue damage or destruction of your body tissues to the point where you'll be totally disabled. It is a condition that you can live with and manage. And there hasn't, none of the research or comes through that it shortens your life expectancy and that you could, be more prone or at risk to other, conditions or issues. So I hope that shed a whole lot of light on the condition. Obviously, I'm going to go through some of the other topics about fibromyalgia in some of the other videos. And the next video in the series is going to go into the medical term definition of fibromyalgia. And I do have a 10-part fibromyalgia mini course that you can check out. And there should be a link somewhere in the description or in the comment section on where you can find out more about that. So anyway, hope you enjoyed it, and feel free to subscribe or leave a comment.